The number of new cases of COVID-19 in South Korea came down today to below 200,000, but just barely. The authorities still expect the peak to be closer to 250,000 sometime this month. In the meantime, they now see little point in imposing stricter distancing rules and could in fact ease them as soon as tomorrow. Bo-kyoung tells us more.
South Korea reported 198,803 new COVID-19 cases on Thursday, bringing the total number of cases seen in the country to almost 3.7 million. Although below the 200,000 mark, the figure is still around 28,000 more than for the same period the previous week. The positivity rate has gone over 50%. The number of critically ill patients increased slightly to 766, and there were 128 more deaths, which is a record high. More than 857,000 people are isolating or being treated at home for COVID-19, while a little over half of the beds for severely ill patients are in use. Among the new cases, Seoul Metropolitan City saw more than 43,000 new cases, going over the 40,000 mark for 2 consecutive days. Regarding how schools brace for the first day of school on Wednesday, the Education Ministry said it is working to make schools safer. The ministry is recommending that students use a self-diagnosis mobile app to share their health condition with schools. More than 83% of students from kindergartens, elementary, middle, and high schools have participated in self-diagnosis tests. Among them, less than 2.7% were advised not to go to school. The schools also provided rapid antigen testing kits for preemptive tests.
As planned, we have secured 6,060,000 rapid antigen testing kits for the first week of March and provided one for each student. The second week's supply of 13 million will be given to students and faculty members by March 4th.
The ministry is also operating movable PCR screening centers for students and staff. Meanwhile, the government is considering easing measures as it sees any strengthening of measures to be ineffective. Originally, social gathering caps of a maximum 6 people and 10 p.m. shutdown orders were to remain until March 13th. However, as the government is to put all efforts into minimizing the number of critically ill patients and deaths rather than the number of the cases, the country is mulling over easing the measures. Though not confirmed yet, the government might announce the changes to the rules as early as Friday after consulting with medical experts, business owners, and local governments. Bo-kyoung, Arirang News.